right, so a charge nurse is delegating a task. The nurse understands that which of the following represents effective delegation. Select all that apply. A, referring to the ANA Code of Ethics of Effective Delegation Practices. B, delegating a task that should be assigned to a manager. C, delineating the desired outcomes of the delegation. D, monitoring the delegated task is being accomplished. Or E, asking the nurse if they are capable of completing the delegated task. Select all that apply.
A.
You're telling me A?
Mm-hmm.
Oh, no. Referring to the ANA Code of Ethics for effective delegation practices when you're delegating a task.
I'm confused as to what you asked me.
So the question is asking you, what are you, the charge nurse, going to do for effective delegation? So saying, if you pick A, you're saying that every time you delegate, you're going to refer to the ANA Code of Ethics.
I got you. Okay.
Mhm.
That's what I'm expecting next. Okay. So, not A.
Okay.
Can you say B again?
B is delegating a task that should be assigned to a manager.
No. So it's not B.
C is delineating the desired outcomes of delegation.
Yes.
D is monitoring the delegated task is being accomplished.
Yes.
And E is asking the nurse if they are capable of completing delegated tasks.
Yes. C, D, E.
Okay. Good job. A nurse.
I was expecting more of a like, you give this to the A, I
Yeah.
never experienced it.
Sometimes they can break it down in a weird way. A nurse is aware that priorities need to be continuously set and reset in order to meet the needs of multiple clients. Which principles of client care should the nurse use for prioritization when giving report? Select all that apply. Prioritize systematic before local. Prioritize acute before chronic. Recognize and respond to transient findings. Prioritize potential problems before actual. Listen carefully and don't assume.
B, C, E.
You said B, C, and E? No.
A.
Listen carefully and don't assume. A is yes, prioritize systemic before local, and prioritize acute before chronic.
Which one was that? B?
Say it again.
The chronic before.
The acute before chronic is, yeah, that's B. Right.
A, D, E.
Yep. Did you understand why?
Yes.
Okay. Okay. A nurse is obtaining a sterile specimen from an indwelling urinary catheter. Place the following steps in the order the nurse should use to obtain the specimen. A. Remove clamp to resume drainage. B. Drain the catheter's tubing of urine. C. Place urine sample in sterile container. D. Clamp the urine bag below the port for 20 minutes. Clean the injection port of the catheter, drainage tubing with antiseptic. Attach a sterile syringe to the port and aspirate quantity of urine required.
I'm sorry, but this question I'm not going to be able to tell you because I have to see this.
Okay.
That was the kind of question I actually have to put in order with my eyes. I can't read it.
Okay. I'll hold that one off. We'll go back to that. That's another one. Okay, here's one. A nurse is reinforcing teaching with a client about implementation of a bowel training program. Which of the following interventions should be included in the plan of care? Select all that apply. A. Advise the client to lean forward at the hips while sitting on the toilet. B, choose a regular toileting program that's based on the client's pattern. C, avoid the use of time limits for defecation. D, drink hot milk in time. Or E, take stool softeners daily.
I want to say B and D.
Okay.
So I got
Well, why would you say D?
tell me what it is. I
D
just
is
wrote it down.
drink hot milk before defecation.
Hot things make you get aroused.
Milk though?
No, not necessarily milk. I was just thinking hot.
Mm-hmm.
Okay.
Like hot tea,
Yeah.
stuff like that. Mm-hmm.
Hot coffee.
Hot coffee.
Carrot.
Okay.
Was that wrong?
That was wrong.
Okay.
So choose a regular toileting time based on the client's pattern.
That was B, right?
That was B. That's correct. Advise the client to lean forward at the hips while sitting on the toilet.
Yeah.
Yeah.
Okay.
And take stool softeners daily.
Take stool softener?
Daily.
Was that E?
Mm-hmm. Yeah. Why not? Well, if you think about it, in a long-term care facility. Most older adults take Colace every day.
Yeah, you're right.
Mm-hmm. Now, laxatives is something that we discourage because it's habit forming, right? Okay. A nurse is caring for a client who has difficulty swallowing following a CVA, cerebral vascular accident. Which of the following interventions should the nurse implement? Select all that apply. A, elevate the head of the bed 90 degrees before feeding. B, encourage client to flex head and neck back when swallowing. C, maintain suction equipment at the bedside. D, encourage client to place food in front of the mouth. E, evaluate swallowing reflexes before feeding.
ACE.
You said ACE, you say ACDE? Okay. So A is correct. Elevate the head of the bed 90 degrees. C is correct. Maintain suction equipment at the bedside. And E is correct. Evaluate swallowing reflexes before. D was putting the food in front of the mouth. Well, you don't want to put it, when they're saying in front, they're like at the tip. So like at the tip of the tongue, that won't help them in getting the food back. It'll fall out, things like that. That's their rationale. A nurse is providing pen care for a client in skeletal traction for a tib-fib fracture. Tibia-fibula fracture. Which of the following findings should the nurse report to the provider? Select all that apply. A, +1 edema of skin at the pen sites. B, loosening of the pens. C, purulent drainage from the insertion sites. D, crusting at the pen sites. E, muscle spasms.
Oh, yeah,
B and C. Okay. Final answer? B, C, and E.
Can you say E?
Muscle spasm.
Oh, you will report muscle?
Mm-hmm. Which of the following diseases should the nurse anticipate using droplet precautions? We should get this one right? Select all that apply. Pertussis, tuberculosis, varicella, scarlet fever, and mumps.
TB, varicella, and mumps. All wrong.
Dagger eyes. I'm going to read the choices again. Pertussis, tuberculosis, varicella, scarlet fever, and mumps. Droplet precautions.
Scarlet fever.
Mhm.
Did you say measles? Mumps.
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 Mm-hmm. And what else?
This is airborne?
Droplet.
Oh, droplet.
Pertussis. Mumps, pertussis, and scarlet fever. Droplet precautions. A nurse is feeding a client with dysphagia. Which of the following should the nurse do to prevent aspiration? Select all that apply. Provide a brief rest period before eating. Assist the client to flex the head to a chin down position. Place food on the weaker side of the mouth. Consult with speech pathology for evaluation. Position the client in an upright seated position in the chair.
A. Oh, you're stressing me out. B.
D,
E.
E. And what else?
C. Say it again. You tuck the chin.
Okay, so that's B. Assist the client to flex the head to the chin down position, right? Tuck the chin. And D is consult speech pathology, and E is position in an upright seated position. C was place the food on the weaker side of the mouth.
Oh, okay.
Yeah. And A was provide a brief rest period before eating. That's incorrect because the client should be provided no less than a 30-minute rest period before eating, which is not
Oh,
brief.
okay. I was thinking a right rest period between.
All right. We got it. We got it. The nurse will need to wear a standard mask when caring for the client of which disorders? Pharyngeal diphtheria, respiratory viral influenza, Hep A, TB, and meningococcal pneumonia. When do you wear a standard mask?
Select all of them.
Yes, ma'am. Hep A and tuberculosis.
I don't know. That one I don't know.
Standard mask. What type of mask do you wear for TB? You wear N95 respirator with TB. Respiratory influenza, yes, you wear a mask. That's B. Meningococcal pneumonia, yes, you wear a mask. That's E. And you also wear a mask with pharyngeal diphtheria. That's A. Last one. A nurse is caring for an intraoperative client. Which of the following are basic principles of sterile technique? Select all that apply. Hands must stay below waist level once sterile gloves are applied. Sterile surfaces may touch other sterile surfaces. Surgical gowns are sterile from the chest level of the sterile field. A 6-inch perimeter should be maintained around the sterile field. Once a sterile package is opened, the edges are considered unsterile. B, C, and E, yes.
That's all.
You tell me, is that all?
That's what I'm saying. Are you saying that's all?
Oh, B, C, and E, that's correct.
Oh.
Yep. Any other choices? That's it. B, C, and E it is. Sterile surfaces may touch other sterile surfaces. Surgical gowns are sterile from the chest level of the sterile field, and once a sterile package is opened, the edges are considered to be unsterile.